people from so many different places. Zoe from Bristol, hi there. Habiba from London. So yeah, if you know, it's brilliant. So we're just going to introduce ourselves really. So my name's Sultana and this is Imtiaz, and we're basically members of LARAF, which is the Labour Against Racism and Fascism. I'm also I'm a part of the Ilford South CLP. I campaigned for my local MP to get in, and he did. I'm also doing a master's in culture, ethnicity and diaspora at Birkbeck. So that's kind of my thing right now. But yeah, so that's basically what I do, and I'm a local activist. Imtiaz?
Hi, my name's Imtiaz. By profession, I work in IT, but outside of that, I'm a trustee of a independent primary school in Ilford, as well as a panel member on in an organisation called the Federation of Redbridge Muslim Organisations, who have recently written to Keir Starmer about his stance on Kashmir in India, and some of you may have seen that there. So, yeah. So that's me.
So he's a local activist too. Mm-hmm. He's being shy. Okay. So welcome to our living room. This is our living room, and we'll be hosting the call tonight. And we hope that you are all doing okay. You're safe. You're healthy wherever you are. And we're really excited to have such an auspicious panel. I'm super excited to have some of the people that are on the panel be able to, you know, to kind of get to speak to you guys and hear what you have to say. On this week's call, if you don't already know, we will be discussing the coronavirus crisis. Oh, sorry, that's you.
Sorry. Carry on.
No, go on, Karen.
Oh, well, I was going to say on this week's call, we'll be looking at why the coronavirus crisis has disproportionately affected Black, Asian and minority ethnic communities, looking at the structural and institutional issues that have been prevalent for so long, and which this crisis has exposed, and we have seen this reflected in such high level of deaths within the community. The coronavirus has deepened the deep inequalities of wealth and power in this country, as we all know exists. And this is something we have seen manifested in every aspect through the health inequalities, leading to fatalities, economic and material impacts, Black workers being twice as likely to be in often insecure agency contracts and lower paid jobs.
Yeah, I mean, despite all of this and being overrepresented as key workers, the government suggests that we all go out and clap for key workers, Black and ethnic minoritized communities. They are the ones who've been disproportionately faced higher levels of prejudice, discrimination. I mean, we hear about these things all the time, that in normal circumstances, sometimes you hear cases where people don't want to be treated by Black and ethnic minority kind of people. And at the time of Corona, that's not going to go away. So, you know, we're still facing discrimination and oppression at the hands of the state. From the migrant health surcharge, police brutality, the pre-criminalisation, the PREVENT programme and the hostile environment that we, you know, has been coined as a phrase now, through to continued deportations and the government's refusal to close the detention estate, Black and migrant communities have been targeted unfairly for years, often with little in the way of due process and accountability. That's not news to anybody.
Yeah. Okay. Sorry. And despite the clear disparity in the number of deaths among Black health workers, the government has chosen only to offer a non-committal review into this, headed by Sir Trevor Phillips. The Labour Party has now also committed to its own review, led by Doreen Lawrence. Meanwhile, the Jubilee Initiative are calling for an independent public inquiry with a clear framework and timetable for reporting, so that these issues cannot simply be kicked into the long grass. We'll post a link in their open, as well as some other useful links in the chat box below throughout the call, okay, as we go along.
Okay. So we're really excited about today's call and the amazing speakers that we've got lined up for you guys to discuss these issues tonight. We're going to run through the introductions and then get started with our first speaker and Q&A.
Yeah. We will be opening our call tonight with Roger McKenzie, who's the Assistant General Secretary at UNISON, the Public Service Union, representing over 1.4 million workers. Roger was previously at the TUC, where amongst other roles, he was Race Equality Policy Officer, We're grateful for him for giving up his time to share his thoughts on the current situation. Then we'll be hearing from Dr. Sonia Adesara, who is working on the front line at London Hospital. Welcome, Sonia. And as well as the Dr. Sonia is a campaigner with Docs Not Cops, advocating for migrants' rights, as well as gender equality in recent services. In health services. Sonia is also currently a co-chair of Young Medical Women's International Association. Whoa, that's a mouthful. And a huge thanks to Sonia for joining us again and giving us her insight into such a pressing issue.
Okay, and after that, next we'll have Shabana Taj, the Acting General Secretary for the TUC in Wales. Shabana previously worked in retail, call centres and the third sector prior to becoming the Welsh Secretary for the Public and Commercial Services Union, the PCS, and then serving as the president of the Wales TUC. Shavanah is a trustee for the Henna Foundation, which supports victims and survivors of domestic violence, wicked work, and honour-based violence, and also a trustee of FIO, a grassroots theatre group that encourages young working class people to engage with arts and culture.
Right, and finally, we'll round off the evening with Suresh Grover, who's the director and founder of the Monitoring Group, which was formally established in the 1980s. The Monitoring Group has decades of accumulated experience in challenging racism, sexual and religious violence, as well as holding state agencies to account for misconduct and discriminatory behaviour. They've led campaigns to help the families of Stephen Lawrence, Zahid Mubarak, and Victoria Clomby. Suresh has continued to be very active in the local community, as well as lobbying politicians through the Monitoring Group, including the COVID crisis. We should be done with the call, hopefully in about 90 minutes. Just to say that if you have any questions during the call, please post them in the chat box and we'll put them to the speakers and hopefully they can then answer. But time is very limited and so we'll only be able to take a few of them, but please do send them in.
So happy to have the panel. On a personal note, I just want to say I'm really happy to finally meet Suresh Grover because I used to live in so this is like a huge, huge honour for me. And also Roger McKenzie, who I met at a recent event, and you were absolutely brilliant. And the other two ladies, fantastic. I'm just honoured to be with you guys. Finally, we're still all learning to Zoom, me and Imtiaz, all the functions. So please bear with us because we're completely technophobic. So if there are any issues, please forgive us.
We're aware that Roger has to leave at 7 o'clock sharp. So what we'll do, we'll kick off straight into Roger's talk. And hopefully after that, we'll have about 5 minutes for Q&A. So Roger, again.
I can just say Roger is an Assistant General Secretary of UNISON, the Public Service Union. He organises and represents and supports its members, many of whom are doing a tremendous job at a really difficult time right now. So hi, Roger, great to have you on the call. I'm aware you've got to go by 7, so we'll hand it over to you.
Yeah, thanks very much. I'm really honoured to be on the call, particularly with Shavanah and Suresh, two great activists within our movement, and Sonia as well, who's doing some great work as well. My sincere apologies that I'm going to have to leave. Obviously, I'm not going out anywhere, but I'm going on to another call shortly. So who knew you could kind of move around so quickly? I spent years turning down meetings because you couldn't travel across the country from one meeting to another quick, but now you can, obviously. So it was only a few weeks ago where care workers were told that they were unimportant, that they were unskilled, that they didn't really matter. And one of the reasons they were told that is because of so many black workers, so many women, so many migrant workers working in that sector. So the government couldn't have given monkeys about that sector. And really they dissed those people. And now these are the people who we are all, I'm sure, standing outside on a Thursday evening at 8 o'clock applauding. Now, I want everybody to be really crystal clear. I have no problem whatsoever with standing outside on a Thursday evening at 8 o'clock and giving people applause. I think it's well overdue that their contribution to society was properly recognised. But you know what? You can't eat applause. And that's the problem, right? And one of the things that most concerns me is that we're going to get to a situation where a few weeks ago, they didn't really matter. Now, these are public heroes. and that we get to a situation again where suddenly they don't matter again. People need to remember this moment. People need to remember when those workers come along and say, we need to get paid properly for what we do, because you know what, loads of these workers, and again, I absolutely underline this, all of these workers, so many black workers who are being treated like something that's scraped off the bottom of somebody's shoe by many, many employers. And many of these employers, and I'm not just talking about the private sector employers who we've got real problems with. And frankly, part of this whole debate really needs to be about bringing the care sector back in-house, really needs to be about nationalising the care sector, so we're not in this situation again where you get people treated so badly by the care sector. But we also got to deal with what's going on within the public sector as well. We also have to deal with what's going on in hospital trusts up and down the length and breadth of the UK. I went to, I remember getting a call from one of our branch secretaries in Bristol, and they said to me, come along and see, I need to show you something. And they took me to a part of this hospital in Bristol where only staff could go. So only staff could get into this particular bit. And they showed me KKK scrawled on this, on a wall. They also showed me KKK scrawled in a lift. This is only a place where staff could go. We shouldn't look at this like this is somehow new and there's some kind of revelation that racism exists, or that somehow all the things that we've been saying, now people can turn around and say they were right after all about all this institutional racism, never mind all the direct racism that we are still facing. We're still, right? So we're not walking down the street and getting abused in the same numbers, although it's still going on, by the way. We're still able to walk. We're not just walking down the street. Now what's happening is we're getting abused online, because we're having these meetings as progressive people on the left. We're having these meetings. Guarantee this, know this, that the right wing are also having these meetings as well, and they're planning how to disrupt our meetings, and they're planning their latest racist attacks. I hear today that two footballers, Ian Wright and Gabby Agbonlahor from Villa, that both of those have had racist abuse online. This is not something that is stimulated by the coronavirus, but it's given them the space. Those people who want to do that, is giving them the space to plan their attacks on us. I want to make a point. I know that the other speakers are going to concentrate particularly on the rise of the disproportionate effect on of the virus in the UK. I want to spread it wider for a little bit, because I think we're seeing something quite important happening internationally. Because if you look at what's happening, yes, we've seen the way that the virus attacks the Black community more in the UK. We've seen the rise of racist attacks to celebrities, but generally across the piece online. But we've also seen the re-emergence of lynching again in the United States, where Ahmaud Arbery attacked in the street, out for a jog, and he gets attacked and killed in the street. Not yesterday, not the day before, but back in February, and nothing happened about it. Nothing happened. The only reason something happened is because a film emerged of what actually took place. Otherwise, these people would still be out there. We also see in France, where they see that it's okay to say that in the search for an antidote to the virus, it's okay to test these things on people in Africa. That's what they said, right? We also see in Brazil, where that fascist out there, who's the head of that government, just has no compulsion whatsoever in making sure that the Black community out there are being attacked. We see it in Canada, we see it elsewhere, we see it across the whole of Europe. This is a massive attack that's taking place against the Black community. And in this country, when I bring it back here, we see Black people, and the rest of the care sector being deliberately put in harm's way by this government, deliberately. They are told that they will get PPE, they will get personal protective equipment. Nothing comes of it. They're told it will arrive tomorrow. They go to work tomorrow and still no personal protective equipment, or what little bit of it there is. They're told you have to reuse and reuse again. This is outrageous what is taking place in this country at the moment. And there has to be a day of reckoning about this. Part of that day of reckoning can't just be that we'll just have a public inquiry and that we'll just hope that something happens as a result of however many public inquiries take place, whether they're from the Labour Party or from the Tories. One of the things that we know as activists, and Suresh in particular knows this with all his years of activity in this, is that we will get nothing from inquiries unless we organise to demand justice about what is taking place at the moment. It's going to be organising that will make the difference. Organising is the thing that will make the difference. And I think we have to use the time that we have, where we're stuck indoors, where we're having to be in this state of lockdown, to use the time to think about organising, but also to use the online facilities that we've got to press members of parliament, to press the government, and to press the Labour Party as well as the trade union movement, to take a firm stance against the racism that's taking place. Because I know, as a black activist of many years, that I've never been given anything, because out of the goodness of somebody's heart, it's never, ever happened and never will happen. The only way we've ever got anything is when we've been prepared to stand up, organise and fight for those things. And I'll tell you what, if we want to see these inquiries mean something, then we have to be the ones who are setting the terms of those inquiries, making it clear that we will accept nothing less than an absolute vindication of the line that we're talking about, i.e. that it's not an accident that somehow there's been an out of proportion effect on the black community. This is the poverty, this is the racism, institutional and otherwise, that we have been talking about for so many years. And now all of a sudden they're going to pretend that they're going to listen to us, right? I don't believe that. They will listen to us when we're powerful enough, when we're organised enough, when our voices are heard and acted on. So we use the time that we've got now to organise, but we also have to think about what it is that we're going to do when this lockdown finishes. Because I tell you, we're going to be faced with massive austerity in this country.
We'll give you another minute, Roger.
Yeah, sure.
Sorry,
they're going to come after us. They're going to cut public services again. So they might stand out and applaud public service workers, care workers on a Thursday at 8 o'clock. But they're going to come back in a few months' time and try and cut those jobs. We're already hearing about what's going on in local government, where the whole the settlement on pay on the budgets for local government is favouring the Tory shires again, and the very areas where the black community lives is being slaughtered again in terms of funding. You know, so if nobody on this call should ever think that they're going to be, they stand outside of Parliament and do their applause and they're not going to come for us afterwards. They are coming for us. And unless we're organised and we stand up against racism, we organise against racism, but we, importantly as well, we stand up for public services and make the case for public services in the hands of publicly accountable people, not in the hands of private profiteers, because that's what's going on at the minute, and that's one of the breeding grounds for racism. Thank you very much for listening. My apologies for not being able to stay with you for the rest of the evening, but good luck and keep up the fight.
Could you just stay a couple of minutes for maybe one question, perhaps?
Sure.
Would that be okay?
Yeah.
Thank you so much, Roger. That was absolutely excellent. I can't think of what else could possibly be said.
Yeah.
And we're so honoured that you spoke tonight and you said what you said. I just want to take this opportunity to plug TWT, because we know that people are kind of in financial straits at the moment, and that's why any TWT things that are done online are free. And especially right now, we make them free of charge to everybody, because we want people to join. We want people to come and listen. We do believe that we need to organise. So it's really important. If there's anything else that you kind of, any suggestions or ideas that you may have, that's really important. We do have some questions, I think. Just go Yeah, so just about the TWT, the coronavirus crisis is a challenging time. If you are able to donate to us anything, £5 a month, anything, then we will be able to put that back into the work that we do. And you can sign up at the worldtransformed.org. Please read the link. It's the worldtransformed.org /support. Okay, so questions. Right, so these are the questions that we have. Which we start. We've got loads of questions. What are the best ways to apply pressure, Roger? The pressure that you're talking about, Roger, to the LP, for example, and perhaps to the unions. Who do we apply pressure to?
Everybody. I mean, I've been around long enough to understand that just because someone's in the Labour Party doesn't mean to say that they're going to be an obstacle, not going to be an obstacle. And I've been around long enough to know that just because someone says they're a trade unionist, that it doesn't mean they're not going to be an obstacle as well. So we have to be relentless. And part of what I've always said, and you know, and somehow people will think that just because the Labour lost the general election, that somehow the things that we were talking about in that election have suddenly gone away. That they haven't. Poverty is still there. The racism that we talked about is still around. The poverty, the racism that many of us experienced during the election campaign actually is still around as well. No amount of applause to care workers is going to make that go away. What we have to do is what I've always said, we have to build a movement. We can't do this on our own, but we can if we're part of a movement. A movement is the thing that's going to make a difference and bring about what we were saying in the general election, which is this irreversible and fundamental shift in society in favour of working class people.
Okay, thank you, Roger. Any other questions, or should we just move on?
I think, considering I think Roger needs to leave, what we'll do, yeah, we'll let you go, Roger.
Thank you so much.
So thanks for joining us. It's been great having you, and that was a great introductory speech.
Thank you, and good luck on your next call. Okay.
Right. Okay. Now, guys, what we'll do is we'll now be hearing from Dr. Sonia Adesara. Sonia is a doctor on the front line of the crisis and an outspoken champion for migrants' rights. She has recently taken part in one of Labour's Against Racism and Fascism Sunday evening workshops and raised hugely important points about the pre-existing structural inequalities that Black communities face within the sector. So I'd just like to welcome you, Sonia. Hi there, great to have you with us.
Thanks.
I know it's a very, very busy time for you guys, and you know, we're all out here clapping for you. We appreciate what you guys are doing, but nonetheless, it doesn't come without risk, and we know exactly what you guys are putting out on the front line. Yeah. You know, your own lives at risk, and we really do appreciate that. So without further ado, I'll pass it over to you. Go for it, well, whenever you're ready.
Thanks everyone for having me, and thank you, Roger. I share your frustrations and anger at the current situation. I've also been just, I guess, tearing my hair out over the past few weeks. And you know, particularly we keep hearing from the media commentators that this is a surprise that Black and ethnic minorities are dying disproportionately, that, you know, if we just find this Black gene that's causing them to die, then everything would be okay. And you know, this narrative is obviously very problematic and unscientific, but also it is, you know, diverting scrutiny and accountability away from those in power who have known and allowed these disparities to exist and have not taken the action needed to address these long-standing injustices. So I think first of all we need to be clear what we mean when we're talking about races and ethnicity. These are not biological categories, these are social constructs. So the boundaries around these categories relate to sort of quite flexible and complex things of ancestry, language, culture, food. But you know, of course, the consequences of these boundaries are materialistic. So what I mean by that is ethnicity and race, they are not biological categories, but the consequences of racism are biological. So I'll try to explain that for you in the next 5-10 minutes. And then the other thing that I think we need to be, you know, really clear on is that these disparities that we see, these health disparities between different racialized groups, in this country and also in the US. These are not new. So we've known for many years in this country that Black and ethnic minorities have poorer health outcomes, face greater barriers accessing healthcare, and are also at greater risk of premature and preventable deaths. And if you look at other areas of healthcare, so maternity care, mental health, cancer care, when we disaggregate the data by ethnicity, we see these quite similar, stark disparities. And to a large extent, these health inequalities between racialized groups do mirror the social and economic inequalities that persist in our country. So your health, to a really large extent, is determined by the social and economic world that you're born into and the exposures that you get from that. And we know that in this country, Black and ethnic minorities are more likely to live in poor and overcrowded housing, much more less likely to have access to open space. We know that Black and Pakistani and Bangladeshi groups are much more likely to live in poverty, much more less likely to have savings. So of course, all of these factors will increase your risk of getting the virus, and also risk factors of having poorer health in general. But we also need to be, that is just not, we know that's the case, and that's pretty obvious. I think the question that we need to be asking is why, why do these inequalities exist? So why is it that for a BAME person, it takes them 2 to 3 times as long to find somewhere to rent in London than it does for a white British person? Why is it that for a Black and ethnic minority, they are over-reliant in these insecure, low-paid jobs, the jobs which we know are at high risk of dying? We've seen that in the ONS reports that were released this week. So why do we have these racial inequalities persistent in our labour market? And why do we have racial inequalities within our healthcare system? So if you look at maternity care, for example, we know that a Black woman is 5 times more likely to die in childbirth than a white woman. And of course, there's different factors underlying this, but predominant factor in academic research is that when Black women, when they are complaining about their symptoms, when they're in pain, they report that their symptoms are not being taken seriously by clinicians. And there's lots of other studies to show a similar picture. So there was a study done of an A&E department, and it looked at how long it took from when someone presented with chest pain to getting treatment for a heart attack. And it found if you're an Asian woman, that time was significantly longer than if you're a white man. In the US, there were studies looking at A&E departments, and essentially the biggest predictor of whether or not you'd get pain relief if you had a fracture was your bias within healthcare professionals. And we also need to acknowledge that institutional racism within our NHS has been a problem that we've known about for many years, and to be frank, hasn't been sufficiently addressed. So prior to this, we're more likely to be complained about, we're more likely to face disciplinary action, and crucially, they were much more less likely to feel able that they could raise concerns and speak up if they were being bullied in the workplace, or if they had concerns about workplace safety. And of course, in the past few months, this has become a life and death matter. We know that many healthcare workers have not had, anecdotally from colleagues, but there's also been surveys to show that particularly Black and ethnic minority doctors and nurses who have not had the equipment or have failed the fitting test, so the equipment doesn't fit them properly to offer optimal protection, yet have been forced to continue putting themselves at risk on the front line. And even if they've tried to raise their concerns, they've been silenced and pressurized to continue working in these high-risk settings. And finally, I think this is something that we can't be passive about this issue. I think we really need to be calling out the government's failings on this, because this really is a life and death issue right now. So Boris Johnson this week saying that people who don't work from home should be going into the workplace without having those necessary safeguards and protections in place. We know which workers we're talking about. We're talking about our transport workers, our Uber drivers, our cleaners, our security guards. Of course, these workers are predominantly Black and minority ethnic and are working class, predominantly going to be reliant on public transport. So why are we unnecessarily putting them at risk? I think, I saw today on Twitter that everyone's very happy that the government have committed to extending the furlough system, so they'll be paying wages, 80% of wages to people. But again, this does not cover people that are in insecure jobs and precarious work, people in our social care system. Again, workers that are predominantly BAME, working class, are not getting protected by this. And lastly, we still have in place, despite the fact that we have a virus pandemic and people are dying, we still have in place a hostile environment in our country. So that means migrants, undocumented migrants, those who are waiting on Home Office decisions, are deterred from accessing healthcare because they are worried about being put into detention centres. They don't have access to public funds. So, during this pandemic, they are not able to stay at home. They have to continue working because the alternative is facing destitution. So I guess to finish, I welcome that the government said that they're going to do a review into the BAME deaths. But to be frank, we've had previous reviews. We know about the disparities that exist. And I think what's more important right now is that we learn the lessons from the past. And particularly when we're thinking about how we come out, the political response to the economic crisis from this coronavirus. We can't make the same mistakes from the past. We need to make sure that we don't widen these existing inequalities, and we need to ensure that our political response really commits to addressing these underlying problems of structural racism, that addresses these fundamental problems of having these quite entrenched inequalities in our labour market. We need to have a fairer, these injustices and these inequalities will persist, and we will continue to see BME communities and working class communities disproportionately hit by illness and disproportionately dying from illnesses and viruses in the future. Thank you. Science.
Yeah.
Do you want me to keep talking?
Sorry. Hello. Yeah. Thanks for that, Sonia. I think there are probably a few internet issues where you are. We had the voice scrambling, but a lot of that came across
clear, yeah.
Okay.
Yeah.
But hopefully, with these questions and answers, we'll try and pick a couple.
Yeah. So we have a question for you, Sonia. Somebody has asked, have more BAME medical staff died? I think you've answered that. And why do you think that is? Why do you think more BAME medical staff have died? Sonia?
Why more BAME medical staff are dying?
Yeah.
Yeah. Can you hear me?
Yeah. Sorry, we are experiencing some issues here with the internet. The question was why? Why do you think more BAME medical professionals have died?
Yeah. So you say why more BAME
Okay.
Yeah.
It's really hard to hear you, Sonia.
Right.
So there are the underlying problems that with regards to racial inequality that put BME people at risk. There's a particular, can you not hear me? Right. Okay, I will go outside. Do you want to come back to me?
Yeah. What we'll do is
come back to me. I'll go outside.
Yeah, that's fine. Hopefully, maybe towards the end, there'll be less people using it. We don't know.
Yeah.
But we'll try and get you again on towards the end, then, Sonia.
Because it would be really important that we do hear from you and hear some of the things, because there's lots of questions. What we can do is we'll go back to Sonia after maybe the next speaker, if that's okay.
Okay.
Sonia.
Just before our next speaker, we'd like to share something with you. Momentum's national coordinating group elections begin on the 28th of May, and nominations for those wanting to stand for the NCG will open at midday on Thursday, the 28th of May, and end at midday on Thursday, the 11th of June. A one-member, one-vote ballot will then be held on midday on Tuesday, the 16th of June, until midday on Tuesday, the 30th of June. All members who have joined Momentum and are up to date with their membership payments by midday on Thursday, 11th June, will be eligible to vote. So further information for that will be sent out to Momentum members. shortly. If you're not a member and would like to take part, please consider joining Momentum. A link will be shared in the chat
box,
below.
Yeah, in the chat box.
Okay,
so we're going to just go on to our next speaker, and we'll come back to Sonia after the final speaker. So our next speaker is Shabana Taj. She's the Acting General Secretary for the TUC in Wales and the first ever Black, Asian or minority ethnic woman to be appointed. Yay! Hi Shabana, I'm going to pass it over to you. Just before we come to it, okay, that's fine. So Shavanah, I'm just going to hand it over to you. Go ahead.
Okay, great. Thank you for inviting me to speak and say a few things. So yeah, I am the first person who looks like me doing this role, so it's all kind of interesting. I have, because of the role that I'm currently in, but actually just, I guess, because I'm quite nosy, not only am I engaging with government, I'm also making sure that I remain connected to what's actually happening within the community and what is happening across the whole of the UK. So there isn't a day that I am not talking to government, whether it's Welsh government or some kind of like UK connection or whatever. And I can tell you now for free, I am more often than not the main person that refers to the disproportionate impact on BAME people. There is nobody else that talks about these issues. So I think that it goes back to the point that if we are not around the right tables where these decisions are taken, and if we if we don't take up the appropriate space, or if you do have that space and you're not willing to speak up and to be vocal, and you're just going to nod ahead, then nothing changes, right? That's number one, because the speakers before me have already talked about the fact that, yes, what's in front of us now is really awful, it's shocking, people are dying. But people have been dying for a long time. We're talking about it now in the context of COVID-19, but people have been dying. People have been dying from BAME communities. These workers have been dying. Many people, as far as, you know, access to the social security system is in this country is concerned. The social security system is broken. People are not paid the real living wage. People have day-to-day lives to lead regardless of what is going on. COVID-19 is an additional thing. But the fact of the matter is that, you know, the TUC nationally, we did some polling just before COVID-19 actually happened. And 56% of BME women and 48% of BME men told us that they had been given harder jobs, more dangerous jobs to do. They were actively rotated into those jobs more so than their white counterparts. Now, this is information, this is recent polling that we picked up. So this backs up what is actually happening right now in front of us on a day-to-day basis. There is not a day that doesn't go by. One of the first things that I did here was said, right, we need to set up a whistleblowing platform. A lot of people don't actually even know, you know, what they can do in a situation if they feel that they are working somewhere and they're not even sure if they're meant to be in work, right? So let's set something up where people can anonymously tell us what's going on. What's been really interesting is that we have had a large proportion of BME workers from health, social care, all kinds of different backgrounds and settings that have been reporting in to the whistleblowing site. And what's been interesting is that whilst they're reporting anonymously there, they will, in one way or another, get in touch with me personally to say, by the way, I've reported in, but they do it anonymously because they're still scared as to what's going to happen to that information going forward. People are really scared that potentially they will be made redundant, that if they say something or, you know, what is the repercussion for me? People are in a very precarious position. Many people are now, you know, having to, particularly if you're, you know, an agency worker, again, the amount of agency workers that are telling us, particularly Filipino workers, Portuguese workers, who are telling us that actually, when it comes to PPE, we're still not getting it. It's still not coming back down to us. We're being told that actually, because of the fact that your agency, you're not as important as somebody who's directly employed. They are active. There are wider issues as well, because actually many people are in low paid work. So it's not just about even PPE. The fact of the matter is that just to make ends meet on a day-to-day basis, people have to work the extra hours. They have to work the extra shifts. So there is, because of the financial situation that they're in, many people are migrant workers. Many of them are currently in a position where they're going to have to renew their visas. Every 2.5 years, they've got to renew their visas. They've got the NHS surcharges. There's no recourse to public funds. There's all this other wider stuff going on. These are and so when we talk about PPE and we talk about testing, and I'm on a call, a weekly call where we go into this great detail about PPE and testing, and I'm like, okay, this is great, but what can you tell us how this actually correlates as far as ethnicity is concerned? You've seen the ONS figures. How does this factor in? And actually, even on a national level, at the moment, the government is not collecting data when it comes to testing. So some of the information that they're going to be picking up, when people are talking about this public inquiry, which I support, but actually I agree with the previous speaker. I agree with what Roger was saying. We're going to have a public inquiry, great, but who is going to set the terms for the public inquiry, and how long is that actually going to take? We're still waiting on Grenfell. Again, lots of people died. What happened afterwards? What happened as a result of all of these inquiries? Again and again, people talk about, oh, we need to have a particular type of risk assessment. But actually, even within the current guidance, there should have been individual health risk assessments in place. Now, it doesn't take a genius to figure out. You don't need to be some kind of like amazing scientist. You don't need to be some kind of specialist to understand that certain groups are disproportionately being impacted. They're dying as a result of COVID. What are we actually doing about it? Why haven't they immediately looked into ensuring the risk assessments take place? Again, in Wales, groups have been set up to look at some of this detail, and we keep saying, it's great, it's good that we're doing these things, but it just kind of feels like things are slow. And I think that this is a problem. This is a problem that we're facing because of the fact that actually the system, the structure that we have to operate within is structurally divisive, is discriminative, it's unequal, it's unfair, and it's unjust, quite frankly, regardless of whether it's now or whether it's in the future or whether we look in the past. I've been concerned that one of the big things that have been pushed as well is, oh, all brown people, yeah, you know what, guys, take vitamin D and somehow that's gonna fix you. Well, actually, that isn't the answer to everything, and I'm deeply concerned about the fact that how do we ensure, you know, how at this moment in time, what checks and balances are there in place? I mean, you know, I've got various different health conditions, and therefore I've had blood tests on a regular basis on a normal, you know, in normal circumstances. I know that I don't have a deficiency as far as vitamin D is concerned, but now the government is telling me that actually I should be taking vitamin D. Now, there's going to be lots of people who are going to be asking these questions, but, you know, for me, a lot of this is down to when people say, why have so many key workers died from BAME backgrounds? And I personally, my position is this, and that is that the government didn't do enough work to get the message out to people to begin with. The lockdown should have happened a lot sooner. We could see what was happening across the world. We could see how this was impacting people. That didn't happen in the way that it should have happened. I'm now in discussions about a return to work. We want to make sure that people are safe when they start physically returning to work. What is that going to mean as far as, you know, transport is concerned? Again, majority of, you know, people have to rely on public transport. How are we going to make sure that that's going to be safe? Seeing some of the images as we do of, you know, the London Underground, even during lockdown, the fact of the matter is that people still had to go to work. Cleaners were still going into buildings where those buildings had been shut down. and having to take public transport and exposing themselves potentially to this virus, knowing fully well that they are being disproportionately impacted. I mean, where is the care for those workers? Who actually cares about these people? And I just think that if we are not united, if we don't have a clear plan, if we are not building power in the right places, or we do not have control over the narrative of any kind of inquiry and what that's going to look like, I just think it's going to be another thing that happens. It's going to be another thing that gets noted. Many people are saying that it's a good thing to do. I support it too. However, I am genuinely concerned about what that's going to mean. Loads of, as some of the other speakers have mentioned as well, the fact of the matter is that not everyone has been furloughed, not everyone has benefited from the, from the government protection schemes, etc. Particularly, for example, taxi drivers. And again, we know that they have been disproportionately impacted as well. Here in Wales, we had a case in Newport where, 2 brothers died, both were taxi drivers. We've had other cases in Birmingham where a group of 5 friends all died from COVID-19. This just, it just kind of feels like we continuously fall through the cracks. And whatever we do going forward, my position is that I would encourage every single person out there to join a union, get involved in your union. And, if you are going to join the Labour Party, and if you are going to engage, make sure you're a member of a union, because quite honestly, as far as the Labour Party is concerned, if you're not a member of the union, then sometimes certain things can kind of get lost in translation as well. I think the trade unions have a big role to play when it comes to the BAME community and getting messages out about.
Okay, Sonia, can I just ask you to close up here, please, because we're running very close to time now.
Yeah, just to say that I think that the trade unions have a role to play at this moment in time, and what we need to make sure is that we make ourselves as accessible as possible. Not everyone can afford to join a union, and we should be looking at all kinds of options, including for those workers that currently, for those individuals who can't currently afford to join a union, to have some kind of a promise from those people to join a union when they can actually afford to do so. But I'll leave it there. Thank you.
Okay, brilliant. Well, that was great. Thank you so much, Shavanah. That was absolutely a fantastic insight.
We just ask some questions.
Yeah, we'll put some questions for you that have come in to us.
Yeah. Okay, so somebody's asking, a public inquiry will take too long. Meanwhile, people are dying. I think we all feel that. What action should we be taking now as a movement? I mean, you did outline one, which is to join a union. Is there anything else that you could possibly add to that?
I think that the more people can join up with discussions like this that are happening, but also think about what it is that you can do grassroots level within your communities, within your areas as well. Sometimes we kind of forget how important that actually is and how that fits into the bigger picture. All these institutions and structures are important, but actually this stuff has got to come from the grassroots in order for it to mean something.
Yeah. Okay, how do you think we can ensure that BAME key workers are recognised equally for their work post-COVID, unlike our BAME soldiers in the world wars? I mean, we kind of like retrospectively kind of, valorise Black and Asian soldiers, but it's kind of like in bits. It's kind of like, decades and decades and decades after. And it feels as though this is going to happen also with BAME key workers. So what do you think we could possibly do in that regard to make sure that they're not just,
I think that we need to be, again, I think that the TUC, the trade unions have a real role to play here as well. There's quite often what you will find is that when there are images, videos, etc., that are released of what a key worker looks like, we're sometimes missing from those images. So I think that one of the things that we can do is make sure that happens, and also that those key workers who are from those backgrounds are given the opportunity to have a platform to be able to speak about what it is that they're actually doing in the first place. So for people to hear it directly from them about the role that they are playing at this moment in time. I think that, you know, it would be good maybe for this group to think about how we can work together on that and how we can get some of this messaging out and not wait for somebody else to do it for us. I think that's often, you know, the case.
Yeah.
Well, I mean, I'd like to ask, do you think that the fact that there's a lot of BAME community members in public-facing jobs, such as taxi driving, bus drivers, you know, street cleaners, you know, and other public-facing jobs, do you think that the fact that there's more BAME community in that's also a reason why we may be seeing a high number of deaths in the BAME community?
Yeah, I think so. I think that, again, it's back down to the fact that people have carried on working. There haven't been risk assessments put in place more often than not. People don't actually understand what it is that happens potentially when they go back to their families. How could I possibly pass on this virus? Again, there's people who are, you know, when it comes to social distancing in certain jobs, people don't even actually know what their rights are. Again, it goes back down to the fact that we need to have spaces where we can inform people, to educate people on what their rights are, on what they can do, and actually the fact that they can refuse to work if they feel unsafe, and give them the confidence that we will be there to support them if the employer chooses to try and make them redundant. Because people are there's so many cases of people being forced into a position where they're really scared that they're going to lose their jobs. And if you have a family to feed, what are you going to do? Quite often people will just stay quiet and just do whatever they got to do to make ends meet. It's like, you know, COVID is one thing, but about, you know, survival is another. How are you going to feed your families? That's what people are scared about.
I think that feeds in really nicely to the next thing that I was going to say. Thank you so much, Shavanah. You've been absolutely excellent. I was going to just talk a little bit about LARAF, which is, I'm a member of LARAF, which is basically Labour Against Racism and Fascism. And also that we also hold workshops that have been running every Sunday at 6 p.m. via Zoom. LARAF been discussing many of the issues that have been raised in the call tonight and working to raise awareness of them with mutual aid networks across the UK. And we have some people from mutual aid here today as well. If you'd like to join those workshops, please join LARAF too, LARAF's mailing list, which is, or follow our events listings on Facebook. It will be posted in the chat and we'll post those to you. But thank you so much, Shavanah. That's been absolutely brilliant. So we'll just carry on now to our next speaker.
Right, okay, yeah. And Sultan says, now on to our final speaker of the night. We're absolutely delighted to be joined by Suresh Grover, director and founder of the anti-racist organization, the Monitoring Group, and lifelong anti-racist campaigner, to speak with us about the societal impacts of the lockdown, the policing and authority during the crisis, the Black community's experiences of interactions with the state. So hi, Suresh, thanks so much for joining us this evening.
Thank you for inviting me to speak at this fantastic event. You know, listening to other speakers, I thought I'd change my speech slightly and focus on institutional racism within the health service. I hope you don't mind, and I'll say something about policing as well.
No, please go ahead.
There's no question that the government must be held to account for its failure to protect the public by not following the basic principles of emergency planning, public health, infectious disease control, and the advice from the World Health Organization. But in my opinion, so should the leadership of the National Health Service. They too also must be held to the account for their role in the unnecessary deaths of National Health Service patients and staff. We are told, and the media like to play this game and say that COVID-19 does not discriminate. But the truth is that the state agencies do, including the National Health Service. And the fact that the virus would strike hardest at the most vulnerable was both predictable and predicted. From the outset, the virus was exposing the fault lines of inequality in our society. At face value, the evidence about disproportionality is actually abundantly clear. We don't need a review for this. Figures show that people of color coming from BME communities account for about 14% of the UK population. They make up 40% of National Health Service doctors and 24% of the nurses. But 70% of frontline workers who have died are actually people of color, and they make up 34% of those critically ill patients. An overrepresentation that appears consistent with the data emerging from USA, where African Americans and Latinos are also vastly overrepresented in COVID cases and deaths. You know, I've been involved in 4 or 5 inquiries. Stephen Lawrence, which I coordinated for the family during the private prosecution and during the public inquiry. Zaid Mubarak, killed at Feltham Young Offenders Institute. We know he was killed by a racist, but why was he killed in such a closed environment and secure environment? Victoria Klimbia, killed by an 88-year-old young girl, killed by her aunt in incredibly torturous conditions. I'm a co-participant at the undercover police inquiry, which has been initiated by the then Home Secretary Theresa May to examine the spying by police of protest groups, etc. And I'm also involved in Grenfell, supporting lawyers, Justice for Grenfell, as well as about 24 families. What's clear is that the British state's reactions to reports, whether it's from Macpherson Lawrence to Scarman report on policing, its long successful track record in absolving itself from the consequences of institutional racism that it has created. The government asking the National Health Service England and the National Health Service Improvement and Public Health England to lead a review is reminiscent of the police investigating themselves. It reminds me of the Kent police investigating Stephen Lawrence's murder, who said there was nothing wrong until the public inquiry came wrong. It reminds me of the CRE under Trevor Phillips having an inquiry into Zaid Mubarak's murder and said, actually, there was nothing wrong until the public inquiry came in. The government is ignoring the obvious conflict of interest. And I suspect, as the police have always, the National Health Service will be doing everything to whitewash their own review and ensure that their institutional racism is not exposed and scrutinized. Let's look at what the problems are. And I've been taking notes while people have been speaking and trying to research into this. And it becomes clear that the National Health Service is using, as people have said, racialized data to argue that Black people are dying from COVID-19 because they are sick. They assume that there's a correlation between diabetics and South Asian, whatever that means. It's such a vaguely defined term, populations, is both real and somehow causal. Correlation is not causation. But for NH leaders, it seems that the equation is answered. Asians get diabetics because they're Asians. Blacks have hypertension because they are Black. And therefore, there is nothing intervening variable, such as racism, that needs to have some concern for them. It's just inevitable outcome of their biological inheritance or melanin skin distribution. They ignore the structural factors and work environment that are systematically involved in how people are treated. The NHS leaders also suggest that those who aren't dying of comorbidities are likely dying because they are from lower socioeconomic groups living in high density, resource poor settings with an accompanying high risk of viral spread. Put simply, those of us who are not dying because we are Black are dying because we are poor, even though there is no data to confirm a similar spike in deaths of poor white people with diabetics or hypertension, etc. Of the 3 million people in high exposure jobs in UK, the essential workers who are not allowed to self-isolate, even if they could afford to, are mostly women, many earning poverty wages from precarious work on a part-time, temporary or zero-hour contracts. In many sectors, including health and social care, Black and minority ethnic people and migrant women are hugely overrepresented, meaning that low-paid BME and migrant women currently putting their lives on the line to deliver vital care were previously told, as people have said, that they were low-skilled and therefore undeserving of settled immigration status, livable wages or stable contracts. It is the poverty and insecurity that inevitably flows from the structural and instructional racism that has made them vulnerable. But for these new scientific racists and the new right, they're just living in their genetic inheritance. However, the poverty that the NHS leaders claim account for racial profile of the victims in the general population cannot explain the profile among doctors. They're not poor, lacking access, resources, or knowledge. Their risk factor is their work environment. Many of the leaders of the NHS appear deaf to this overwhelming cries from the NHS staff about invisible or inadequate PPP. Yet the data from their own workforce, race equality standard, and staff service point to a long-established institutional racist practices as critical risk factors in BME staff deaths. BME staff are more likely to be harassed by managers, are subjected to disciplinary procedures by their trust, royal colleges, and regulators, and therefore less likely to speak out. How far such fears prevented BME clinicians challenging managers over PP or any disproportionate allocation to COVID-19 wards must be given full consideration and exploration. Similarly, they appear to have ignored the decades of data confirming BME communities' lack of equitable access, worse health outcomes, and higher levels of dissatisfaction with the NHS. If they had not ignored this, if they had acknowledged it, they would have anticipated the institutional racism would intensify in this period of pandemic. It's critical that we actually understand the period we're living in. It feels as if we are traveling in the eye of the storm, an uncharted territory and a crisis of alarming proportions and dangers that has no comparison, in my view, and I've been involved in racial violence, policing, civil rights for the last 40 years, from the time I was stabbed by skinheads in 1973 in Nelson, Lancashire. There's no comparison of what we are facing and the consequences for BME communities and workers over the post-war period. The coronavirus pandemic contains murderous intent against human life. To defend ourselves, we seem to have only the meager armory of hiding indoors and physical distancing to blunt its impact. We do not have any vaccines, nor have we developed any reliable antiviral treatment. We need to ensure that human deaths are simply not registered as nameless statistics, normalized as graphs sketched without any personality. The dead have died alone in this period and are hoarded in makeshift trucks, almost in industrial kind of mortuaries. The gallant efforts of those treating them, the NH staff, cannot stop the monster's path. They too have become victims. Other deaths, no matter how painful they have been, from cancer, from other diseases, from accidents, have become even lesser statistics. That's the period we are living in. And the challenge for us as anti-racist is to be clear on what our strategy, as in extract the issues that we need to fight the establishment and the powers to be, but very clear what the Labour Party wants to do. The Labour Party hasn't worked out what its review is going to be or its terms of reference are going to be. It's dead in the water because it will not touch the issue of institutional racism thoroughly and properly. Just look at its composition. People have been chosen because they are from a specific ethnic minority, rather than the speciality in the health service and dealing with anti-racism. We live in a period where it is absolutely critical for us to come together, as people have said, unite, put our heads together, and look at multiple ways of challenging how the government and the NHS leadership have treated us. We need to collate, verify, harness the clear evidence from our communities, from hospitals, from the care services, and utilize all our experience together against racism to ensure that inquiries, when they are called, are not just tokenistic, but have a real purpose for change. But that can only happen if the public are centrally involved in determining its framework and direction and conclusions. That's all I want to say. Thank you.
Right. Okay. Thanks for very much for that, Suresh. We've got a couple of questions, if you don't mind, come through, which people have asked. Let's see.
I have one here.
Yeah.
Can the BAME community set up an independent inquiry alongside the governments instead of waiting on their report? And if so, how would we go about doing this?
We can't set up a statutory inquiry, but it's a really good question, and I'm great people are thinking like this. What we can do, which is what we did in the Lawrence case and the Zahid Ibarra case, is that we call for People's Tribunal with people of international reputation, hearing evidence that we think is important, and that feeds into a campaign on a national, international level, which then has some influence in any inquiry that are set up. So the government may choose to ignore it, but what it does is it brings peoples together, and it brings different people, workforces from different sectors together. So it brings doctors together with communities, and it brings patients together with care workers. And that is the terrain that is the composition of people that are critical in determining whether there should be a public inquiry.
Okay. Is there a question there that you want to ask? Yeah, that one.
Well, another question came through. What terms of reference should we be fighting for with an inquiry?
What terms of reference should what? Sorry?
Should we
be fighting for with an inquiry? So what should be our terms of reference if we were to put an inquiry forward?
Look, what the inquiry should do, by the way, you know, the inquiry legislation has changed. So it isn't like when we were in the Lawrence period, where the public could, with their lawyers, decide the remit and the terms of reference. What happens is a minister or the Home Secretary or the Prime Minister, whoever it is, will determine whether there's an inquiry. So in this case, it's likely to be, if it's health-led, the Health Secretary. he or she will commission a judge, and the judge will discuss with other people what the terms of inquiry are. But for us, this is the issue that we should be looking at. We should be jointly looking at what the terms of reference is. So what the inquiry needs to do is look at what actually the failures are, what the consequences of failures were, make sure that they are in the inquiry, make sure that the public are involved, make sure that there is total openness and transparency and disclosure of all the documents that the government has and other bodies have, which are given to the inquiry, and that nothing is hidden from the public. And we want to ensure that the trade unions representing workforces that have been affected by this coronavirus are part of that process. We need to make sure that victims who've lost their loved ones in hospitals, families of NHS doctors and care workers who've lost their loved ones are part of that process. We need to ensure that people who are giving evidence from the National Health Service or the government are compelled to come and give evidence, so they can't hide behind any legal arguments. We need to ensure that that this problem is discussed openly, the litany of failures are addressed, and there's a robust forensic examination of the evidence that exists, but it's in an accessible form so everybody can understand it, and that if there are recommendations made, they're in public, so there's more chances of this inquiry being implemented or these recommendations being implemented. The inquiry is useless, in my view, if it doesn't combine issues of corporate manslaughter or other issues which resulted in negligence, negligent deaths of NHS staff, care workers, etc. Those issues are also important. So the inquiry may not look at that, but it may be some agency that looks at the issue of corporate manslaughter. That's the kind of innovative thinking that we require in this momentous occasion. We are living through something totally unusual, and we need to seize that moment, but we need to do it collectively.
Okay.
We really hope that this is an opportunity that we can seize this moment on, these kind of calls. Suresh, thank you so very, very much for your input and your wealth of experience and everything that you've said. I'm so honoured to have met you and for you to have shared your vast wealth of experience. So thank you so very, very much, Suresh.
Okay, I think we've found Sonia again.
Yeah.
Maybe with a new and improved phone or broadband connection. I'm not sure how, but Sonia, are you with us again?
What else can we use for signal?
Sonia? Are you there? Sonia, are you there? Can you hear us?
Okay.
Sonia? Hello, can you hear us? Sonia, we've unmuted you so you can speak.
You know.
Hello? Okay, we're determined to get her on the call.
No. All right, what we'll do is, I think we'll move on. It's not far from 8 o'clock now. So as we come to the end of our call, we just wanted to let you know that.
Oh no, she's here. Oh, there you are, Sonia, you're back. Yay!
I'm not good at technology.
That's okay, none of us are, as you can tell. Okay, so we have some questions for you before we end. We're really glad that you can be back on the call. Let's find the questions. The questions were related to kind of BAME. Let's have a look. Okay. Yeah, BAME medical staff. Your thoughts on why you think that more BAME medical staff are dying at this time? I mean, you did touch upon it, but if you could just give that some more of your thoughts, that would be excellent.
Yeah, so there's those underlying factors of why Black and ethnic minority people are more at risk. And as others have said, they are more in occupations that are putting them at risk. But I think there's also problems of institutional racism within the NHS, and I'm sure we have these issues in other workplaces as well. So I heard your previous speakers, I was coming in and out, but talking about this. We know that Black and ethnic minority doctors are more likely to face disciplinary action, find it much more likely to face bullying in the workplace, less likely, feel half as likely to be able to speak out if there are issues around workplace safety. Like, look, I had a friend of mine call me about this last week, and she had been quite upset because she was working in a really high risk environment around ventilators, which is really high risk of getting the virus, and she'd failed the fitting test. So essentially the mask didn't fit her face properly. She was an ethnic minority, yet she also had underlying health problems. And she told her senior, and her senior essentially told her, look, if I'm putting myself at risk, then you need to as well. So she was pressured into continuing to put herself at risk. And I don't think that's a unique story. And look, we've known about institutional racism for a really, really long time. There was a brilliant study done a few years ago, and essentially it was 2 doctors put out the same CVs, put them out to lots of different NHS trusts, trying to apply for different specialty jobs. And with the exact same CV, if you had a surname that was ethnic or foreign, you're much more likely, less likely to get invited to an interview. So we know this problem exists, and there just hasn't been enough action to address it.
Right.
I think, just adding to that, I think it's really important what you're saying, and what Suresh said that is actually enlightened me, that even though people will say that this is, you know, that Black and ethnic minority doctors, for instance, maybe from like the middle classes traditionally, that they're not from the kind of working classes, so why are they being affected? But I think you touched upon so clearly that there is a psychology that comes when you are from minoritized communities to make sure that you don't sometimes upset the apple cart or structures of power, because you are in those positions. And I think that that element of it is completely missed when we're having this conversation. So I'm so glad that you touched upon that.
And there's also something, I'm not even sure if I mentioned this in my opening statement, but there's also research to show that people that experience everyday aspects of racism, like small everyday aspects of racism, so being treated differently, being disrespected, people being scared of you, we know that that in turn increases your cortisol levels, increases your visceral obesity, and in turn that increases your risk of getting diabetes, hypertension, heart disease, all the conditions that put you at increased risk of dying from coronavirus. We also know that pregnant women, if they're experiencing discrimination during pregnancy, we know that their babies at increased risk of being preterm or having a low birth weight. So there is these wider issues about racism causing those social and economic inequalities, but also experiencing direct racism impacts your health, and there's academic evidence to show that as well.
Yeah, definitely.
Right. Okay. Now, right, since we're coming back to almost up to 8 o'clock, I'm going to go into game show mode. So we'll have one more question, and you've got 2 minutes to answer it. So, and the second question is, why do white people believe it's down to genetics that BAME people are dying disproportionately? So your 120 seconds start now.
Okay, it's an easy scapegoat, it's an easy narrative to blame the genes, but look, we need to be really clear on this. So there is more genetic variation within ethnic minority groups than there is between ethnic minority groups. So going down this narrative of genetic differences is really unscientific, and it is problematic. We know where race medicine leads. You know, look, we had V-Day. We remember you've got quite a recent history of eugenics, so it's really really problematic. But it's an easy narrative that, you know, it's not me, it's the genes. But we know what underlines health inequality, and it's social and economic inequalities, and it's structural racism. But those issues are more, I guess, more difficult to assess, particularly those in power. It's the easy. We shouldn't allow this easy narrative of genetics, which is unscientific, and it's not the issue. And also, you know, I heard the discussions about vitamin D. Look, really be clear about this. There is a difference between association and causation. So just because you have low levels of vitamin D doesn't mean that X, Y, and Z is happening. Vitamin D comes in out of fashion every year, but a vitamin pill is not gonna be the cure for racial injustice. I'm sorry to say, I wish it was, but it's not going to be.
And also that racial capitalism, vitamin D is not going to fix racial capitalism. It's not going to fix those things, unfortunately. Okay, I've got one question that came up online that I think is such a brilliant question, and I think this more than ever, I think anyone can answer this. about allies and allyship, and how white people who may not necessarily be experiencing these things but want to be allies, you know, I think this question comes up again and again and again, that what is the best way, what are the best ways for them to be allies in our struggle at this time? Because we need allies and we need them everywhere. So, you know, want to really ask that. Who can we get to answer that? Yeah, go ahead, Sonia.
Yeah.
Go ahead.
Yeah, I think it's being an ally means supporting these conversations, calling out problematic narratives. Actually, it can be really difficult. You know, I find this myself as an ethnic minority woman working in NHS. I find it quite difficult to call out institutional racism. I see the eyes rolling when I do so. And actually, if I had, it is much more when I have my white colleagues supporting me in doing so, it is much more easier and it feels more comfortable to do so. So we do need allies. If you are not from the BAME community, we do still need you to support us in these conversations, calling out problematic narratives. And so, yeah, please, we need allies.
Yeah, we do.
And this is about everyone, like inequality and justice. This affects everyone. It doesn't just affect BAME community. So everyone needs to be allies here. And the intersections between race and class are also really important. So this should be centered to the labour movement as well.
Yeah. Thank you so much. Thank you, Sonia.
Superb. Right, thank you very much for that. That was well within the time limit. So a prize of a cuddly toy coming over to you soon, Sonia. Right, okay. As we come to the end of our call, we wanted to let you know that TWT are going to be trying to organise as many online spaces for people to interact as possible. And they've created a step-by-step guide for supporting people to run political education and organising meetings online. We will post the link in the chat shortly, so please keep an eye on that. Please also keep an eye out for reading groups and other kinds of political education, organising meetings, and of course, tune into this call same time next week. To stay up to date on all these initiatives, please sign up for our mailing list. The link again will be submitted below. Here we come. And finally, I'll give the last word to me.
You know, if you are able to join TWT, the World Transform Supporters Network, political education on the left is more important than ever. Suresh Grover pointed that out. It's, you know, all of our speakers have pointed that out. Shavanah pointed that out. It's crucial at this time that we have spaces where we can discuss these things so that we can organise, and this is one of them. So please join the mailing list. Please join and become supporters, and so that we can share these ideas and think about how we can go forward. All of that information will be in the chat, theworldtransform.org/support. Thanks so much to all of our speakers and everybody who has sat and tuned in. A huge thanks to Dan, who's been our tech person. And Elia, you've been absolutely brilliant. Thank you guys for being behind the scenes. And a big thanks to everyone who's done so much work to make this happen every day, every week.
And thanks for everyone for joining
in. All 100, you know, 100 and whatever it was. We couldn't do it without you.
Yeah, we hit 200 today.
Yeah, we couldn't do it without you. And that is an awesome achievement. And we're so grateful that you're on the call. And thank you to all our speakers again. And we hope you have a fabulous evening and keep up the struggle, guys. So we're just going to leave it there. Thank you so much.
See you next week, guys.